नमस्ते बेटिया हमेशा खुश रहो बेटिया A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine in Faculty of Homeopathic Science at Jyoti Vidyapeeth Women's University, Jaipur. In today's clinical lecture, we are going to discuss the common presenting problems or the symptoms of the endocrinal disorders. Whenever a patient of endocrinal disorder is coming to you, what are the common presenting symptoms with which he or she can present to you? So let us discuss the common presenting symptoms of the patient with endocrine disorders. There is a long list of complaints or the symptoms which a patient can represent and in a wide variety of diseases. So let us discuss them one by one. The most common symptoms with which the patient of endocrine disorders comes to you includes lethargy and depression, weight gain, weight loss, amenorrhea, oligomenorrhea, polyuria and polydipsia, heat intolerance and palpitations, thyroid nodule, generalized thyroid enlargement, pain over the thyroid, prominence of eyes, hirsutism, galactorrhea, impotency, visual dysfunction, headache, muscle weakness, usually proximal, paresthesias and tetany, recurrent ureteric colic, and coursing the features of. So, lethargy and depression, it can be seen in the patient with hypothyroidism, diabetes mellitus, hyperparathyroidism, hypergonadism, adrenal insufficiency, and Cushing syndrome. If the patient is having weight gain, it can be seen in the conditions of hypothyroidism, Cushing syndrome, adipocogenital syndrome, and obesity. If the patient complains of weight loss, persistent weight loss, then you can think of the various diseases like hyperthyroidism, adrenal insufficiency, diabetes mellitus type 1, hyperpituitarism, anorexia nervosa. If the patient complains of amenorrhea or oligomenorrhea, it can be seen in patients with menopause, polycystic ovarian syndrome, hyperprolactinemia, hyperthyroidism, premature ovarian failure, and Cushing syndrome. In case of polyuria or polydipsia, if a patient is coming with polyuria, that is increased frequency of urine, or polydipsia, that is increased thirst, then you can think of diabetes mellitus, diabetes insipidus, hyperparathyroidism, Conn's syndrome. If the patient is coming with complaints of heat intolerance, then you can think of hyperthyroidism or menopause. In case of palpitation, you can think of hyperthyroidism, pheochromocytoma, and Conn's syndrome. In case of thyroid nodule, you can think of solitary thyroid nodule, dominant nodule in multinodular goiter. In generalized thyroid enlargement, always think of simple goiter, nodular or diffuse, Graves' disease, Hashimoto thyroiditis. If we have pain over the thyroid gland, then we can complain of hemorrhage with pain to nodule, recurrence thyroiditis, rarely Hashimoto thyroiditis. For prominence of eyes, hirsutism, you can think of Graves' disease. Idiopathic polycystic, in case of hirsutism, it can be idiopathic. It can be seen in polycystic ovarian syndrome, PCOS, congenital adrenal hyperplasia, Cushing syndrome, androgen secreting ovarian and adrenal tumors. In case of galactorrhea, we can think of hyperprolactinemia due to tumor hyperthyroidism, drug-induced idiopathic. In case of impotency, we can think of hyperprolactinemia, hypogonadism, diabetes mellitus. For visual dysfunctions, you can think of pituitary tumors, Graves' disease, example, exophthalmic ophthalmoplegia. In case of headache, you can think of acromegaly, pituitary tumor, pheochromocytoma. For muscle weakness, usually proximal, we can think of hyperthyroidism, Cushing syndrome, hypokalemia, example cons and iatrogenic hypothyroidism, hypogonadism, acromegaly, vitamin D deficiency, and osteomalacia. For paresthesias and technique, you can think of hypoparathyroidism. And in case of recurrent ureteric colic, we can think of hyperparathyroidism. Coarsening features consist of acromegaly and hypothyroidism. So these are the various diseases which represents the following given symptoms in case of endocrine disorders. So this is all about the presenting symptoms of endocrine disorders. In the next lecture, we are going to discuss about the physical signs of endocrine diseases. So this was all for today. And the next lecture, we will be discussing about physical signs of endocrine disorders. So this session is powered by digital version 2.0 JAYOTI VIDYAPEETH University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve. So this was all for today. Thank you very much. We will be meeting in the next lecture.